Hi everyone, and welcome to Doc's Thoughts. I'm Dr. Lynn Wagner. Today I want to talk about blood testing and how often you should get your blood tested. So I have a little spin on this that's different than what I was taught in medical school and residency. In medical school and residency, there's screening tests that happen, more in your 40s and your 50s and your 60s, and then there's tests that we do in reaction to a symptom. In my practice, which is more of like a precision medicine practice, we've actually kind of like flipped that a little bit and started to recommend testing a little bit earlier and a little bit more frequently. So now when I see patients in their teens, 20s, 30s even, I do just a complete blood panel and even some genetic testing sometimes, because really what you want to look at is where are you starting from? And when you know where you're starting from, you know where you have to go. And a lot of times we do the full blood panel and the patient is beautifully healthy. They don't need to do anything. They need to take minimal supplements. And so I pat them on the back and say, hey, you're good to go. Come back to me when you have a problem, or let's just check your tests like every year or two. Make sense? Every decade that goes on beyond that, we're finding more and more problems or changes in the blood tests. And when you look at blood tests, as a regular doctor, we have ranges. So for example, a vitamin D range is between 30 and 100. And I tell my patients every day, you never want to be that person who's 30 because it's a huge reference range, and you never want to be on the extremes of any reference range in medicine. So with precision medicine, we're optimizing you to be about 50 or 60. That's going to change depending on where you live and how much sun exposure you get. So you want to change your vitamin D dose throughout the year, or maybe not take any in the summer. So you're really needing to look at things a little bit more frequently and maybe even test a little bit more frequently. And so really when it comes down to it, if you're really young, it's probably good to get a really complete blood panel and just kind of look at where you're starting from. And then you may not need a blood panel for years after that. If you're hitting like the late 20s, 30s, 40s, you definitely want to get a complete blood panel. And then depending on where your deficiencies are, you can have those checked, every 6 months to every 12 months, get your supplements and medications tweaked and your lifestyle optimized. And then you're really guaranteeing yourself for your best longevity and best health span so that you feel amazing even into your second half of your life. So if you guys have any questions on that, I'd love to hear them. At Wagner Integrative Health, we do more comprehensive blood testing because we want you to have your best and healthiest life. We're not just stamping out disease.